Julie Ryan, noted psychic and medical intuitive, is ready to answer your personal questions, even those you never knew you could ask. For more than 25 years, as she developed and refined her intuitive skills, Julie used her knowledge as a successful inventor and businesswoman to help others. Now, she wants to help you to grow, heal, and get the answers you've been longing to hear. Do you have a question for someone who's transitioned? Do you have a medical issue? What about your pet's health or behavior? Perhaps you have a loved one who's close to death and you'd like to know what's happening. Are you on the path to fulfill your life's purpose? No matter where you are in the world, take a journey to the other side and ask Julie Ryan.
Hi, everybody. Welcome to the Ask Julie Ryan Show. I'm Julie, your host, and I'm so delighted you could join us this week. My intention in doing this show is to provide information, insight, and comfort to people all around the world by helping to answer life's unanswerable questions. We have a whole bunch of callers on hold, and I will get to them momentarily. But in the meantime, I'm so excited to be back on because we took a little bit of a break for Thanksgiving. I hope your holiday was terrific, and I hope that you're starting into the Christmas and New Year's holidays with a bang. Most of us have started to put our decorations up, and that's always fun. I'm always glad when they're up. It's so much work getting them up and taking them down, but I enjoy them when they're up. So I hope yours are going smoothly as well. It is the first Thursday of the month, and you know what that means. It's free giveaway time. So every month on the first Thursday of the month, I give away a free session with me. And in order to register for the drawing, all you have to do are 3 easy things. Follow me on Instagram at AskJulieRyan, sign up for my blog at AskJulieRyan.com, and leave a review about the show. And you can do that at ratethispodcast.com/Julie. ratethispodcast.com/Julie. So the winner this month in December is someone who goes by the name of Dana32, Dayna 32. And she says, great podcast, love the show, and Julie does a great job keeping the show positive and flowing well. It keeps the show positive and flowing well. All very fascinating. So Dana32, you have won a 1-hour session with me, free of charge. It's your prize. Early Christmas present. And so just email me, Julie at AskJulieRyan.com, and I will set up a date and time that works well for both of us, and then we'll have a whole hour to discuss whatever you want. Do you want to talk about a medical scan or want to talk to a deceased loved one? I can scan your pet. We could do past life stuff. We can do all kinds of stuff, and it's a blast. I promise it will be so much fun. So just email me, and we'll set something up. All right, with that, let's go to the phones, and I will do my best to get as many people on this evening as we can. Our first caller is Bob. Hi, Bob.
Hi, how you doing?
I'm good. Please tell everybody where you're calling from.
Oh, I'm calling from Tacoma, Washington, just outside Seattle. Bob Adams, and I'm retired, and I have a very nice life. Everything's wonderful, except I got this toothache.
Oh, tell us about your toothache.
And I hate to call you for a toothache. I mean, something a little more serious, maybe, than toothache.
Oh, what's happening with the tooth?
It was very painful, Julie. It really was.
Oh, no.
But I went to the dentist, and they gave me some antibiotics and some pain drugs. And Wednesday morning, it got a little better. But I was just hoping if you could look at it and make sure that all the infection is out of there so it won't return.
Right. All right. So what I'm going to do is I'm going to watch a laser beam come from my body here in Sweet Home, Alabama, and it's going to hook up into you in Tacoma. And I'm going to have a hologram of you in my mind's eye. And it's going to be as if I'm looking at an X-ray or a CT scan or an MRI. And so What's going to happen then is I'm going to shoot energy from your feet up through the top of your head, and then we'll see what comes up, and then we'll watch a healing go from there. How about that?
Wow. Will I feel any of this?
You might.
Bonnie Gordon.
You might.
Okay.
Sometimes you do.
Well, I'll find out.
Sometimes you don't. The way that these healings work, Bob, and everybody, is that the healing happens on the energetic level, and that it integrates into the body, and that can happen instantly.
Oh, I see.
It can take days, weeks, months. It may need some kind of complementary care, but it's always that our spirit's choice to utilize the healing in a way that best facilitates whatever it is we're exploring in this lifetime. So,
okay.
All right. So here we go. So comes my laser beam, and I've got it coming out to you in Washington. All right. Got you coming in. So the energy, Bob, went to the lower left side of your mouth. Is that where the tooth problem is?
Upper left side.
Okay. All right. The energy always goes where it's most needed first. So maybe we've got something else brewing. So let me see. It's not the very last molar. Let me work on this one first. It's the one in front of it. So I'm going in there. And what I'm doing is did you have a root canal in that tooth at one point? Do you remember?
I think I did. But
Yeah, that's what I'm seeing. So what I'm doing is I'm going in and I am cleaning it out. And getting that going. And let me mute these guys that are joining us. And so I'm cleaning that out, and then I'll go up to the one that's up on the upper left side. The root canal one, Bob. The thing about root canals is sometimes there's bacteria left in there that can get in the bloodstream, and so I'm just kind of roto-rootering it to get it to the point where it's not an issue anymore. And I put antibiotic energy in there. It's not infected at the moment, but I think we're heading off a problem at the past. I do this a lot when a tooth has had a root canal, and and I get somebody on my radar. Okay, the upper left side. So is it a molar? I'm seeing a molar. Looks like you've had some work done on it.
It's the third tooth from the big tooth in the front to the left.
All right. So
that tooth.
Right. Okay. So that's a canine?
Yes.
It's the one that's pointy?
Yes.
Okay. I'm in one of the molars. I'm in a molar. Did you have a root canal?
Is it a molar? Okay.
Yeah. Yeah. Well, I'm in a molar right now. That's where the energy is. So I'm doing the same thing to that one that I did on the bottom, which I'm watching that get kind of roto-rooted out, and then putting antibiotic energy in there. And so when things show up that are asymptomatic, Bob, again, it's like we're heading off problems at the past. I just watch where the energy goes. But it looks to me like you've had a couple of root canals on that side of your mouth, both on the upper and the lower.
I did.
Yeah,
That's right.
I can tell. Okay. All right. And then, so the canine looks okay to me. That looks fine.
It does?
Yeah, it looks all right. Is it hurting?
I don't think it was a molar. It was the next one to it.
Yeah, I know. That's what I'm saying. The canine one, which is the one that is the pointy one.
And that one looks okay?
That one looks okay. It looks like I'm not seeing any infection or anything in it. Are you feeling pain?
Yeah, when I press just above that, it's a little painful when I press right above it on my face.
Like in your gum? Oh, okay.
Yes.
So the nerve, the tooth itself looks fine to me. So going up into the nerve is where it's hurting?
Oh, the nerve. That's where the problem is, isn't it? I don't know if you can see if there's an infection in that area, but...
and you're on an antibiotic now?
Yes.
Yeah. All right. It looks a little inflamed in the nerve, so I'm putting anti-inflammatory energy on it, which is a royal blue color, and getting that calmed down. The antibiotic will take it out. I'll put some antibiotic energy in there. What did you have done to that tooth?
Pardon me?
What did the dentist do to that tooth? Did he fill a cavity or something?
No, it hasn't. He didn't do anything. He just go home and take the medicine. And that's what I did.
All right. Okay. I think you're going to survive. But you got a couple of other teeth worked on there in the meantime.
Okay. I really do appreciate it.
You're welcome. Happy holidays.
Thank you. You too.
You bet. Bye-bye.
Bye.
All righty. Let's go to Amy next. Hi, Amy.
Hi. You're so fun. Just for fun, I used charcoal when I had a mouth infection, and it really helped while I was going through the transition. It helped pull the toxins out, but that's not to discount the antibiotics at all, not at all. I was in a crisis, and I didn't have access to them right away, but it worked.
Oh, boy. Okay. Well, please tell everybody where you're calling in from.
San Diego, and that's in California. Everybody who does the United States.
Yeah. Amy, I'm going to hold you over. We're going to take a quick break, and we'll be right back. Everybody, you're listening to the Ask Julie Ryan Show, so stay with us. Welcome back, everybody. We were talking with Amy from San Diego before the break. And Amy, girl, what's up? What's happening there?
Hey, I wanted to ask you, I'm trying to find my way in life, and I love helping people with food issues because I had one for 31 years, and I have been clean for 13 years. And I was looking into doing a food addiction reset with an ARC. It's called the ARC community. And it's a great idea, but I just feel like I'm trying to fit in a square hole because I have so much education and knowledge, and I just feel, is it right for me? Can you ask my spirit guides or the guides, is this really the right way for me to go about this, or am I just trying to fit?
Mm-hmm. Okay. Well, let's get them on the radar, your spirit guides. So is it in Amy's best interest to pursue a career working in the food addiction industry? I get a yes on that, Amy?
Okay, and with the ARC?
With the ARC
community?
I get it's a good place to start.
Okay, yeah, it's with Joan. I mean, it's wonderful, but I'm just like, the training. Do I need to do this training? It's just tedious to me. I just want to do it.
You don't need to do the training.
Yeah, so how can I do this without the training?
Talk to management is what I got.
Okay,
explain to them what your background is. Yeah.
Yeah.
So,
well,
but I think you're on the right track in that industry, doing something in that industry. So good luck. Keep us posted. Let us know what you decide.
Okay. And hey, Julie, I listened to your show finally with Michael Sandler back in August. That was great. You did a great job. I love Michael. He, his vibes are so good. But that was an excellent interview, and it was fun to see you live. So I just wanted to let you know, I enjoy you. You're awesome.
Oh, thank you, you sweet thing. You're making my whole day. We do put videos. If I'm doing interviews, they're all on YouTube. You can listen to the audio or the video and see the video. There's the one from Thanksgiving is up on YouTube at Ask Julie Ryan, and that's fun with Arizona Belle. It was really terrific. So I hope you enjoy that as well.
Oh, she's fun. Yeah. If you're having a down day, you just go listen to Julie. I love being around happy people. So that's awesome. Thank you. I don't want to hold up your time. You got your hands.
Take care. Bye-bye. Okay, let's go next to Melissa. Melissa, let me find you here. Where you are, Melissa.
Hi.
Okay. Hi, Melissa. How are you?
Hi, how are you?
I'm great. How are you?
I'm doing good. I'm in Jalisco, Mexico right now, currently.
Good. How are things down there?
They're great. Yeah, Mexico is always amazing as far as, the energy, and the people and the food.
Terrific. Well, good. You got a question for me?
Yeah, I wanted to see if you could connect with my sister. My sister Jenny, she's pregnant, and she has been so sick her entire pregnancy. And this has happened to her for all of her kids. Like throwing up like 13 times a day, and has to get like fluids intakes from the doctor. Yeah, and I just wanted to see if there was any way that you could tap into her body and see if there's any way to help or give guidance.
Sure. Ginny with a G?
With a J.
With a J. Jenny. Okay. All right. Jenny versus Ginny. Okay. So where is she, first of all?
She's in Milwaukee, Wisconsin.
Okay. And how far along is she?
I believe she's around, it would be, let's see, I think like 18 weeks.
Okay. So she's halfway through, a little over halfway through. And it's not letting up any, huh?
No, it's been like this for every single one of her pregnancies, and she just has a really horrible time.
I'm sorry. Okay.
Yeah.
All right. So here we go. We're going to ricochet here. Here comes my laser beam from Alabama down to you in Mexico, and then it's boomeranging up to Milwaukee. All right. I've got her. And Jenny, I'm talking to your sister, Melissa. Is it okay if I scan you energetically? She's saying no.
Well.
Yeah. I always ask permission, Melissa, before I scan somebody. And so I'm getting a no on that. But that's all right. We can still talk to her spirit. I can scan her, but I won't, because it's an ethical thing with me. I don't want to violate anybody's privacy. So let's talk to her spirit. Do you have a question for her spirit?
She's very stubborn. I'm just kidding.
Okay, she's very stubborn. Yeah. Well, if you talk to her, next time you talk to her, if you talk to her about it, just say, hey, next time Julie wants to scan you, give her permission. And then it'll be.
Yeah, I'll do that.
Yeah, you can do that. But do you have any questions for her spirit?
Yeah, I guess, is there any way that I can help or give guidance to her, from how they guide me into speaking with her, and, what I can do to be supportive.
That's what just came in. Be supportive and pray for her is what I got first. So are you guys Catholic by any chance?
She's very Catholic.
She's very Catholic because she said for you to pray the rosary.
Oh gosh, that's crazy. Okay.
Yeah. So there's a great book. Actually, in my Christmas show, I pre-recorded already, and it's with the authors of a book called The Way of the Rose, Melissa, and it talks about the history of the Virgin Mary, and it talks about the rosary and all of that. So check that out, and good luck with her. Thanks for calling in. You bet. Everybody stay with us. We're going to take a quick break, and we'll be right back. Welcome back, everybody. We are taking callers now, and our next person up is Julie. Hi, Julie. Hi, Julie.
Which Julie?
I am on you. You're unmuted.
Oh.
It's you. How are you?
Okay, perfect.
Julie,
Good.
308 area code, Julie.
Yep, that's me.
Yeah, we're the reason why she's saying that, you guys, is there's another Julie that's on hold. So we said we're like the three Julies, behind door number 1. You get Julie A and
right.
Julie B's behind door number 2. So where are you calling from, my dear?
Kearney, Nebraska.
Kearney, I have been there. Believe it or not.
Yeah, I think I remember when we talked one time.
Yeah.
I mentioned that.
I had been there before because my first job out of school was in South Dakota, and I had a regional sales office in Omaha. So I used to go down there periodically. Well, thanks for calling in. Do you have a question for me?
Well, it's about my original topic, the first time I ever talked to you, my son Chance.
Okay.
And he's struggling in school ever since 8th grade. And now he's a sophomore. And now it's coming to he doesn't even want to go to school, let alone do any work. And so it's just been progressive. Mm-hmm. And so I don't know what the answer is. Is it like a neurotransmitter thing? Is it because he has candida? Is it candida? What is it? Is it something emotional?
Well, if he's got candida, and I'll see if he'll let me scan him and I'll get him on my radar, but if he's got candida, it can affect his brain chemicals.
Well, see, that's what I was thinking.
Yeah. And it's a catch-22 with teenagers because they like to eat junk.
No, I know. He knows he has candida and he knows he needs to do some stuff about it, but he really isn't willing is the problem. So,
well, and you do have a little bit of control over that as to what you bring in the house.
I know. But he drives now, so he can. He just does his own thing sometimes.
Yeah, but for the most part, he probably will run out of money eventually to be buying food. And
he does.
Food at home.
He does.
Yeah. So there is that. There's more than one way to get the goal accomplished, right? Well, would you like for me to get him on my radar and see what's going on?
Yes. Yep.
Okay. All right. So here we go. I'm going to connect to you and from you to Chance. All right. Chance, I'm talking to your mom. I know it's okay. Okay, good. So that's permission. I've scanned him before. So usually when I scan somebody at least one time, they usually let me back in pretty easily. Mm-hmm. Okay. So Chance, what? He's full of yeast. Full. He looks like, normally I'll say that when somebody has an overgrowth of yeast, it looks like if you mixed flour and water together in a paste. Like a roux, if you're making gravy, you mix that together before you pour the pan juices in. He's got it so thick that it almost looks like shaving cream in his GI tract. Okay. So that's what's going on. He's depressed and probably doesn't feel that good. And so he's craving sugar and he's craving anything that's processed. And that's what the yeast loves. And it's the yeasties, it's like a revenge of the yeasties in the stomach. When I had it for the first 40 years of my life, I met the man who discovered it and he got me well. And one day I went into his office, Julie, and I said, "Is it just a character flaw that I crave sugar?" And he laughed.
Right.
And he said, "No, it's the yeast. It's their food of choice." So anything processed, anything that is fermented, you want to try and keep that away from him or get him to do it. And then did you get him on nystatin, Julie?
I have a chiropractor that is kind of a psychic medium type guy too, person. And he was like trying to figure out what was the right source for him. And the nystatin wasn't the best choice for him.
Okay.
And
so he's doing muscle testing or something like that?
We still haven't figured it out, like what's the right remedy for him.
I would try the nystatin. It's nectar of the gods. It works great. I would try it. It can't hurt him.
Okay.
So that's what I would try. Well, good luck. Just try and keep the junk out of the house as much as you can, the junk food.
Yeah, I do.
Okay. All righty. Well, good luck with that and happy holidays.
Okay. Well, thanks a lot.
Okay. You bet. Take care.
All right.
Bye-bye.
Bye-bye.
All right. Let's go to Kate next. Hi, Kate.
Hello.
Hi, Kate. Hi, girl. How are you?
Hi, Julie.
Hi.
I'm in Philadelphia.
Terrific. How are things there?
Things are kind of quiet.
Yeah.
We're the schools are closed. We're hoping that they might open like in a few days. So all the kids are home and they're virtual. All my grandkids.
Mm-hmm.
So that's a challenge.
I was going to say, how are their parents dealing with that?
Well, I babysit when my daughter works 2 days a week. So I kind of like have everybody. And they're in every corner of the house on computers.
Oh, gosh. Wow.
Yeah.
Okay. Well, I understand. All right. Well, how may I help you this evening?
Well, I'm a retired nurse, and I have had a problem with bladder incontinence for 20 years. And I was diagnosed with intrinsic sphincter deficiency. And I was going to have some surgery to see if it could be repaired. And I was inspired to go to an acupuncturist. Just, I didn't want to have a surgical procedure right now with the pandemic. Mm-hmm. So I went to an acupuncturist, and I would like to know if you could scan me to see if it's working. I've had like 3 treatments, and she suggests that I have 10.
Mm-hmm. Do you feel better? Do you notice any difference?
I notice a slight improvement. Nothing really drastic. And also, I'm coping with the sudden death of my husband like 17 months ago. So that's part of the treatment also when I get the acupuncture treatment. She's doing some grief work also.
Mm-hmm. Have you read my book yet, Angelica Tendons?
Yes, I love it.
Okay, good. I was going to say, hopefully that will give you some comfort if you get the opportunity to read that. I would love it if you'd leave a review on Amazon. Anybody listening, if you've read Angelica Tendons, please leave a review on Amazon because it helps other people find this information. And usually it's when they're in most need of comfort. All right, let me get you on my radar here, Kate, and let's see what's going on. So coming up to the city of brotherly love from Sweet Home, Alabama. All right, got you. Shooting energy from your feet up through the top of your head. So did you have a hysterectomy?
No.
No? Okay, so your bladder's dropping is what it looked like to me. It looks like your bladder's dropping. I'm watching it get tacked up right now.
Okay.
So, the old-fashioned clotheslines that people used to hang their clothes to dry on an old-fashioned clothesline. And like if you took sheets and you'd hang them and they'd have kind of a swoop, you'd put clothespins in and then they'd swoop down, you put another one. That's what it looks like when I tack a bladder up. It's hilarious.
Thank you.
You know how my analogies are just hilarious, but they come in a way that I can describe to you so you'll get a quick visual of what's going on.
Yes.
Because as I
think
mentioned
it's
to
spot
Bob,
on. Twice you have mentioned door number 1, and I'm so familiar with that. It was some game show. I don't know what. Something behind door number 1.
Yeah, The Price is Right. I think it's still on the air. Yeah, we watched it when I was a kid. Bob Barker, baby. Yeah, yeah. So I've tacked it up. Let me see. I just think your bladder needs to be tacked up, is what I'm seeing. Have you had how many children did you have?
I had 5 pregnancies and 4 children.
Okay, so it's not that uncommon with women who have a lot of pregnancies. You know that. You're a nurse. So I've tacked that up and see if that helps with that. As far as the sphincter issue, I'm getting a no on that. So that's not what I'm seeing. I'm seeing it's just a bladder tack thing. So hopefully this will help. And I would get a second opinion.
Okay. Yeah, that's always a good idea.
Okay. All right. Well, thanks for calling. Happy holidays.
Thanks so much.
All right. Let's go back to the phones. And Patty, let's try you again. Are you on now?
Yes. Can you hear me?
Oh, there you are. Yes, I can now. I couldn't hear you before for some reason, so glad I can hear you now. How are you?
The phone went blank.
How are you?
I'm fine. How are you? I hope you're staying healthy and safe.
Yes, ma'am. Absolutely. So's Tim.
Okay.
I'm cracking the whip down here. No, not really, but he's doing good.
I'm Patty from Queens, New York.
Yeah, terrific. All right, what you got for me tonight?
Okay, I got a good one, but this is for us, for the whole world. Okay.
Okay.
It's not for me only. okay? But it's for the whole world.
Okay.
I'm an anti-vaxxer, okay?
Okay.
But if other people want to get a vaccine, that's okay with me. I just don't want to be vaccinated. I don't believe anymore in vaccination since about 20 years now. But if other people want to get it, that's fine, because what I do, I have no right to tell somebody what to do with their body. Same way I don't think it's right for other people to tell me what to do with my body, okay? But if people want to get vaccinated, I give them my blessing. I give them my prayers that the vaccine doesn't harm them in any way, okay? Now, because of this COVID vaccine coming out, I'm hearing Qantas Airlines demand that you get vaccinated before you could fly. They're talking about this vaccine passport to fly. You won't be allowed to fly if you don't get your COVID vaccine. I was like freaking out over the weekend. I'm reading online saying that you won't be allowed to go into banks if you don't get vaccinated. You won't be able to go grocery shopping. You won't be able to go to your job. You won't be able to go to church. I'm reading all this, and I'm praying so hard that this vaccine, that this coronavirus disappears. I'm actually having visualizations of for Christmas for Santa Claus. That Santa Claus comes into the planet Earth, visualize him taking away the coronavirus. I'm visualizing New Year's Eve. I'm visualizing 2021, no COVID. Okay, I'm visualizing angels grabbing the coronavirus and taking it all out of the planet Earth. I'm trying to visualize for the whole world to get rid of this disease, because I don't want to get vaccinated.
So did you have a question about this? What's your question?
Yeah, in my question, I'm just concerned about the vaccine. Will we be mandated to travel? No. Will we be mandated?
No.
Are they?
No. I'm getting a no on all of it. And for you to get that wound up about it, Patty, it serves no purpose, because it may or may not happen. And so just take it one step at a time. Back it up. When we get scared, it's usually when we're thinking too far in advance, and most things that we worry about never come to pass. So I think the best thing to do is just focus. I mean, are you planning to fly to Australia anytime soon?
No, but I want to fly to Italy. I was born in the United States, as I think I told you that I have dual citizenship. I have family in Italy. I'm a European Union citizen. I could fly back and forth to Italy with 2 passports. I can enter Italy I can enter all of the European Union countries with my Italian passport.
Patty.
Yeah.
Patty, you're getting all worked up over something that's probably not going to come to pass. So there's no reason to worry about it. Let's just take it a step at a time. And
you think it will disappear, this virus, before the vaccine comes out, or it will be like?
I think people that feel good taking the vaccine should take it. I think people like you that don't shouldn't, and I think it's all fine. There are so many other illnesses and diseases that kill people. There are 600,000 deaths every year in the U.S. from infections that people catch in the hospital. Nobody's talking about that.
Right. Yes.
I mean, this is way less. With the COVID, it's like, use your common sense, keep your immune system healthy, take C, vitamin C, zinc, D3, and you're good. I don't think you have anything to worry about. So you stay calm, focus on what's happening right now, and when you feel yourself getting really wound up and really scared about it, bring yourself back to what's happening right now in this moment. Okay. And
I just want to get on that plane and go to Italy. I just don't want to. I
think you're going to be able to.
Be good.
You'll be able to.
Thank you. From your mouth to God's ears.
Okay. Thanks for calling in. Take care.
Bye-bye.
Bye-bye. Oh, fun. All right. Let's go to Kate next. Hi, Kate. Okay. We already talked to you. Hang on. Let me go. Let's see who's next. Marion. Hi, Marion.
Hi. How are you?
I'm well. How are you?
I'm doing good. I'm in California, Yucca Valley. I think we talked once before.
Yes, we have. Terrific. Yeah. You got a question for me?
I do. I have 2 horses that I haven't ridden in a while, and I started getting back into doing this. And I had a question about if they are okay with me riding them again, or they just want me to leave them alone. There's a way you can talk to them and find out. I tried getting on my Mustang, and she's real calm, but when I tell her to go, she just kicked up her back leg. I do have a chiropractor coming out next week, but I just want to make sure I'm going on the right path.
Okay, what are your horses' names, Marion?
Peaches and Flintstones.
I love that. Peaches and Flintstones. All right.
Yeah.
So Peaches is the Mustang.
Yep, you got it.
Okay. So Peaches, is it okay if Marion rides you? Yes, just not fast. She's saying her back right leg is hurting.
Aha. Well, that's the one that she's picking up. Will the chiropractor help her?
Yes. Yeah.
Oh,
I'm getting that there's something to do with her hoof. I'm seeing like a little abscess or something in her back right hoof. So I'm scooping it out and I'm applying anti-inflammatory energy and antibiotic energy to it. So hopefully when she gets checked, it will be gone. But she's got some kind of an abscess. So check her hoof. I know the hoof doesn't have pain, but there's something like right underneath the hoof. There's some kind of I'm seeing the word abscess has come in, and that's what I'm seeing. It looks like a sore. Does that make sense?
Okay. Yeah, there's something that's known to the navicular, and I'm wondering if she's got that, but maybe it may not be that bad. So.
Yeah.
Okay.
And then Flintstones. Let's see. What is Flintstones a boy? Is he a guy? Is he a male?
You got
horse?
it. Yep.
Okay, so Flintstones, is it okay if Marion rides you? Yes. He says he's out of shape, but yeah, you're okay to ride him. Is he out of shape?
You got it. Yeah, he's my older one. He's 28, but he's got he's got stem and vigor like he's 8. So.
Okay, but you haven't ridden him for a while with the COVID stuff, so he's out of shape, is what he's saying.
Yeah, he is. I've been riding my friend's horses to get myself back in shape. So. But I want to start riding
he's really attached.
Okay.
He's really attached to you, isn't he? He's really attached to you, Flintstone is.
Yeah, I love him dearly. He's my first horse I've ever owned. I've had him I've had him for like 20 years. So yeah.
Yeah. Well, terrific. Well, go work him out, and thanks so much for calling. Yeah, he told me he loves you. Stay with us, everybody. We're going to take a quick break, and we'll be right back, and we'll get a whole bunch more callers on. So stay with us. You're listening to the Ask Julie Ryan Show. Welcome back, everybody. This is the Ask Julie Ryan Show, and thrilled you're with us this week. We do this show every Thursday night at 8 Eastern, 7 Central, and 5 Pacific. The call-in number is 712-775-7035, and the access code is 483620#. Now, this information is available on my website at AskJulieRyan.com and in the show notes anywhere you download podcasts. We are all over the place. We're on YouTube. We're on Alexa. Pretty much every podcast distributor that's available. You can find us just under Ask Julie Ryan. So remember to subscribe and leave a review at ratethispodcast.com/Julie. I would really appreciate it if you would do that. Plus, that enters you into the drawing to win a free session with me. The reason I do that, by the way, is just to thank everybody for listening to the show. And I know $155 is a lot of money to people, especially right now and going into the holidays during a pandemic. So it's just a little something that I can do to help. So ratethispodcast.com/Julie. Also, the call-in details can be found on Instagram, Twitter, Facebook, and Pinterest at Ask Julie Ryan. That's where I am in all those social media. We'll post a reminder to call into this show the day of this show with the number. And if I'm not going to do a live show like on Thanksgiving, because that was a Thursday night, we'll post that too. So you know. So just always check social media for Ask Julie Ryan. Also, when you're on my website, be sure to sign up for my weekly newsletter. It's a question somebody has submitted online along with my answer. And in the body of the email, we'll say, hey, remember, call in tomorrow night. So I'm making it easy for you guys to call in, giving you all the information and every place I can think of to make it easy for you. While you're on my website, you can also schedule an appointment with me. And then we'll have a whole hour to talk about whatever you want. We can scan you medically. We can scan your animals, like what we just did with Peaches and Flintstones. I love those horse names. We can do past life stuff. We can talk to deceased loved ones. We can talk to spirits still attached to a body. We can talk to spirit guides, angels. I mean, I am a buffet of psychicness. So it comes in handy. And we can talk about any and all of those things during the hour that we have together. So the key with scheduling an appointment is I'm scheduled out a couple of months in advance. Go ahead and get on my calendar, and then you're going to get a confirmation email, and there'll be a reschedule button at the bottom of the confirmation email. Click on that periodically, and it will show you other dates and times that may be sooner that have opened up. People reschedule all the time, especially during the holidays. And a lot of the time you can get in pretty quickly. I mean, I've had several people that were scheduled after the first of the year get in within a couple of days because an appointment opened up. So everything's at AskJulieRyan.com. One other thing I wanted to mention is my new book, Angel Messages for Dogs, will be out soon within the next week or so, and I'll let you know when that's available. It is just darling, you guys. If you have a child or a grandchild or a dog lover in your life, it's a picture book. The illustrations are all individual pieces of art. They're watercolors and pastels, and I have all of them. I got all the individual drawings that made the illustrations in the book. So you're going to love it. It's the second in the series of angel messages. The first one last year was angel messages for kids. This year it's angel messages for dogs. So remember those on your Christmas list, and obviously remember angelic attendants as well. All right, let's go to the question that was chosen for this week, and it comes from Kathleen, and Kathleen lives in Door County, Wisconsin, and she asked, "Hello, Julie. I've been living with and caring for my dad for over 8 years. This also includes caring for my mom, who died of cancer 6 years ago. As you can imagine, I'm very exhausted and conflicted about placing him in a home. I tried twice. It didn't work out and broke my heart. I never thought my dad would live this long without my mom, and I'm now realizing he could live for another 10 years. I'll soon need to come to terms with placing him in a home because I really need to start living my life again. I don't even know what that will look like because I've really lost myself in all of this caregiving. Can you please tell me what phase of transition my dad's in and if he has any helpful messages for me? Thank you, Kathleen." And here's my response. Hi, Kathleen. Good heavens, girl, you deserve a Medal of Honor for being such an amazing daughter and caregiver. In order to get some information for you, I energetically connected to you and from you to your dad. He's begun the dying process and is currently in phase 4 of the 12 phases of transition. Now that is what we all go through as we're dying. And it's a configuration, for those of you that haven't heard of this before, it's a configuration of how our deceased loved ones, spirits of deceased pets, and angels surround us. And they take on a different configuration as we approach death. Everybody's surrounded by deceased loved ones and angels, whether their dying situation is something instant, like in the case of a homicide or suicide, or whether it's prolonged, like a long time, like Kathleen's dad. So I went on to say, and by the way, there are graphics of this on my website, AskJulieRyan.com, and you can download them. If you have somebody in your life that's dying and you want to know what's going on, download the graphics. Okay, I went on to say this means his spirit is out of his body and attached to the top of his head. It looks like a bubble containing the words or thoughts of a character in a cartoon. The spirits of your dad's deceased parents are at his feet and anchor a horseshoe of angels that surround him. When I asked your dad if he was ready to go, he said yes. When I asked your dad if he was in pain, he also said yes. When I asked him what he needed, he said he needed to see your mother. Regarding seeing your mother statement, it's common for people to see deceased loved ones in dreams and or visions at the end of life, and I believe this will happen too and comfort your dad. To learn more about this phenomenon, consider reading Death is But a Dream by Christopher Kerr, MD, PhD. In his research, Dr. Kerr, the CEO of a large hospice and palliative care center in Buffalo, New York, shows how prevalent and, most importantly, comforting dreams and visions are to dying patients. Death is But a Dream discusses university-based research that mirrors what I describe in my book, Angelic Attendants, what really happens as we transition from this life into the next. Namely, angels and deceased loved ones greet us and lead us into paradise, also known as heaven. As for transferring your dad to a care facility, I'm making air quotes, which means information downloaded into my head when I ask the question. It's in your best and his best interest to do so. I also get it's in your best interest to consider a hospice or palliative care facility. In addition to his getting taken care of by medical professionals, you could also visit him there. When somebody's in hospice, what I'm hearing around the country is their family can still go visit them. It's just the nursing homes and the assisted living places that are locked down. And then I closed with Dartmouth Hitchcock Medical Center. That's Dartmouth University's medical center, has put together a terrific fact sheet entitled, Should I Put My Relative with Alzheimer's Disease in a Nursing Home? It's full of thought-provoking questions designed to help you make the best decision for your dad and for yourself. Hope you find this information helpful. And if you want to click on any of those links, you guys, just go to AskJulieRyan.com blog, click on the blogs, and you'll be able to click on that link to the fact sheet. It's really terrific. I've had several emails from people who've read the blog already that are in this situation, and they said, oh my gosh, what a blessing that is to find that. So thank you, Kathleen, for submitting that question. It's one that I think a lot of people deal with. And so hopefully that will help. Okay, let's go back to the phones. And our next caller is Michelle. Hi, Michelle.
Hello.
Are you there? Hi. Where are you calling from?
I'm calling from Louisiana.
Okay, terrific. You got a question for me?
Well, actually, I wanted to see if I'm thinking of traveling for the holidays.
Yeah.
With all the pandemic stuff, I know they're saying you shouldn't, to visit my son in California, and I live in Louisiana. And I just wanted to see if my spirit guides or my guardian angel thought that was a smart decision.
Yeah, so let's ask, is it in Michelle's best interest to travel to California to see her son? Are you going to fly, Michelle?
Yes.
Yeah, I get a big resounding yes.
Good, because you know what? I was like, I'm going to go. And I said, well, maybe I better double check.
Absolutely. Absolutely. I personally have flown 3 times since June. It's great. Mm-hmm. It's great. You got seats available next to you. The planes have never been cleaner. Of course, I'm flying Delta because I live in the deep South like you. But Delta has been just doing a fabulous job. The airports are terrific. Everybody's wearing masks. I say go for it. Go have a wonderful holiday with your son.
Good. And you know what? I might check out Delta because I was on the fence of which airlines. But I'll try Delta.
Yeah. I've flown Delta 3 times, and I even, on 2 of those flights, Michelle, I was able to upgrade to first class for like an extra $40 or something. It was great.
Oh, my goodness. That's incredible.
So check that out, too.
Check that out. Absolutely. Awesome.
Okay.
Well, thank you. And I enjoyed your
welcome.
podcast last Thursday with Arizona Belle. It was really great. I just listened. Thank you so much.
Terrific. Thanks for listening. Okay. Have fun with your son.
Have a good day. Thank you.
Take care. Bye-bye.
Bye.
Okay. Let's go to Tracy next. Hi, Tracy.
How are you?
Hi, Tracy.
How are you?
Good. How are you? Good.
Good. I'm calling from Raleigh, North Carolina.
All right.
And I had a private reading with you last month, so thank you for that. And you had directed me to listen to some podcasts, which I did, and I did get some information out of it. And had a couple of quick questions, yes or no ones for you. My daughter had seen this past, 2 weeks ago, had seen Dr. Reese in Charlotte. And I was wondering if that was, checking in with the guides, if that was a person that would benefit my daughter and cure her. Dr. Reese?
Would benefit your daughter, yes. As far as curing her, there's not a doctor or a healer on the planet that can cure anybody. All they can do is help us heal ourselves, because everybody's spirit is on their own path, Tracy, and it all unfolds based on what that person's spirit wants to experience. You know, you think about surgeons who have back-to-back cases in the OR, and they're identical. Patients are both in good shape. Surgeries go perfectly. One patient heals, one patient doesn't. You know, there's not one thing that surgeon would have done differently. So there's nobody on the planet that can cure us except ourselves. What doctors and medical caregivers and people that do work like I do, what we do is we help people we help them heal themselves by facilitating healing. Does that make sense?
It does. It does.
Yeah, but I do get that he's a good fit to help her.
Okay. And would the MRI and the blood work, is that going to show mold or sears?
I get no on both.
Oh, brother.
Yeah, I get mold. Yeah, no on both. So that's why I wanted you to listen to those podcasts on mold, because most doctors don't know what to do with that. They don't know how to treat it. And a lot of the blood tests that they do, you know, really just don't apply. So I don't know what he's done, but on these in particular, I'm getting a no.
Right. But we do have that Dr. Reese is going to be a benefit.
I do. Yeah, I think he's going to be able to help her heal.
Okay. All right. Thank you. And will she be returning to a brick and mortar school, a high school? And will that be on Long Island or North Carolina?
I get a yes on Long Island.
Oh, okay. That's good.
Are you thinking about moving there?
Well, we have family there, and we've been trying to make the North Carolina high schools work, and we just keep getting slapped down. So my daughter today thought of maybe moving up to Long Island with her godmother and seeing if their school district would be a better help than ours.
Oh, all right. Well, good luck. Keep us posted on
thank you. Okay. I appreciate it. You take care.
Stay with us, everybody. We're going to take a quick break. We'll be right back and get some more callers on. Welcome back, everybody. Let's go to the phones again. And I believe our next caller is Colleen. Hi, Colleen.
Hi, Julie. Can you hear me?
I can. How are you?
I'm okay. How are you?
I'm terrific. Thanks. Please tell everybody where you're calling from.
I'm calling from Ashfield, Massachusetts.
Okay, terrific. How are things up there? Do you have snow?
We did, and then it melted, so it's been pretty beautiful. We actually missed the snow, though, to be quite honest.
Yeah. I got a picture from my brother who lives in Columbus, Ohio, and I think they got 5 or 6 inches of snow there this week. So,
oh wow,
it got a little chilly down here in Sweet Home, Alabama. I put a video up of it sleeting here, and I was saying, "Oh my gosh, it's sleeting here, you guys! That's wrong. That's not supposed to sleet here." So wow, it was pretty funny. It was like little ice pellets on my deck. So check out my Instagram and Facebook, and you'll see sleeting in Alabama. When snow's predicted down here, it's hilarious, Colleen, because they just cancel everything with the thought that snow may even happen. Even if it doesn't come, they cancel it because we don't have any equipment down here. So it's, it gets a little treacherous. Yeah. Well, you got a question for me?
I do. Thank you. I have been dealing with lower back, pelvis, hip pain, pretty bad, and tightness for about just over 6 years, and it's been getting worse and worse. I pull my back out of the blue probably every 3 weeks now, and that has been used to be like every 3 months, and then 2 months, and now it's 3 weeks. So I'm wondering what to do. I do stretches and yoga. I bought this program to take care of everything, but nothing seems to really help, unfortunately.
Okay. All right. So I've gotten you on my radar while you were talking. Do you see a chiropractor?
I do not.
Have you ever been to one?
I have, yeah.
Okay. You're a bit of a twisted sister. So I'm watching a chiropractic adjustment happen that's going to help straighten out your back. You're a little bit twisted. So that's number one. Number two, you sound like you're about 18. How young are you?
I will be 42 in a few months.
Okay. All right. You've got a little teeny bit of disc degeneration on the left side, low back left side. So imagine, my analogies are really hilarious at times, so hang with me. Imagine your spine and your discs look like a slab of baby back ribs. Okay? How's that for a picture? And the ribs represent your vertebrae, and the meat represents your discs. So when some of the meat, in a slab of baby back ribs is eaten, the ribs start to collapse, right? So I'm propping them up, and I'm using stem cell energy to regenerate the disc that looks like it's degenerating. And stem cell energy is the absolute coolest stuff, Colleen, because it looks like a light amber colored gel. It has sparkles in it. It's a watery gel, and it reminds me of this hair gel back in the 60s and 70s called Dippity Doo. You're probably too young to remember that, but everybody that's my age or older knows exactly what I'm talking about. And then I'm watching a vortex spin above your back, and that is going to transform that stem cell energy into new disc tissue. And his stuff is so cool because it'll regenerate whatever we need. So I'm watching that. So that's going to prop up that side of your back. My guess is you lean a little to the left. You may not even be cognizant of it. But, sometimes when we sit on a computer or we sit in front of a computer, whatever, we'll lean to one side. Do you notice that you do that if you think about it?
Yes. Yeah, and that's where most of my pain is, on my left side. So that does make sense.
So what it does is it starts to, just kind of have your spine lean over. So we've regenerated the disc. Hopefully that will happen. And that will keep you, lined up. And I would go get an adjustment from a chiropractor.
Okay.
I think
so this is something
my
partner and I are thinking of getting pregnant next year. And so I'm so worried because this area. So this is something that can be fixed, or
absolutely
healed with. Yeah.
Absolutely. Yeah, absolutely.
Wonderful.
The body has a tremendous capacity to heal. I have watched just miraculous things happen with the body being able to heal. We just help it along a little bit with the energy medicine, the energy healing, and it's an adjunct, as I consider it, to Western and Eastern medicine, for that matter, as we know it. So it's just part of the equation. The energy healing, the working with the chiropractor, that kind of thing. If you need surgery, get surgery. I don't think you need surgery right now. I just think a chiropractor is going to help you a lot.
Okay. All right. Well, thank you so very much.
Good luck getting pregnant. By the way, you do have a baby's energy over your right shoulder. Looks like a little orb. And baby's energies attached to the mom's energy field sometimes years before they incarnate. And have you ever seen an orb in a picture, like maybe a family photograph?
Yeah, for sure.
Yeah, those are spirits.
Wow.
I have people send me pictures all the time, and they've got an orb in their picture, and they're saying, all right, who is this? And so we'll scan it. Sometimes if you get it on your computer and you blow it up, you can see a face in those orbs, which is wild. So good luck.
Yeah, that is wild. Cool.
Good luck. All right, let us know when the baby comes.
Care.
You too.
Oh,
Bye-bye.
thank you. All right. Bye-bye.
Let's go to Daisy next. Hi, Daisy. Hi, Daisy.
Yeah, hi. Yes, hi. Daisy from Ocala, Florida.
How are you, girl?
Hello, can you hear me?
I can.
Okay, good. I just want to be sure. Yeah, need your help with lower back pain.
Yeah.
I'm in a lot of pain today.
Mm-hmm. Okay.
And also with the sinus is getting worse.
Okay.
I used to be able to snore through my throat, and now my face feels like I'm snoring with my face on the right side, and it hurts even to breathe.
Mm. And you have a mold problem in your home, right?
I don't know, but I did follow your advice. I bought the home biotic spray. I bought the
Okay, Daisy, hang on. I'm going to need to take a quick break. And when we come back, we'll pick up the conversation. Stay with us, everybody. We'll be right back. Welcome back, everybody. We were talking with Miss Daisy from Ocala, Florida before the break. So, Daisy, you were saying that your sinuses are really giving you a fit.
Mostly with my lower back today. My lower back is
back.
in a lot of pain.
Okay. All right. So what I'm doing is I am giving you a chiropractic adjustment like what we just did with Michelle, the caller right before you, to get that calmed down. I've got anti-inflammatory energy on your back, which inflammation, again, looks like red fog over body parts. Do I remember correctly that we saw mold before in your home or your condo?
You say that you see mold. I don't know what it is. I don't hear, but I bought a 6-pack of the home biotic, and the home health aid has been helping me spray it all over the house.
Terrific. I think that's what's going on with your sinuses, is I think it's a mold thing going on. So that's good. What Daisy's talking about, everybody, is a non-toxic spray called Home Biotic, and it's a spray that has bacteria in it that eats mold. You know, biotics, like antibiotics, it's like antibiotic for the home, and it works great. I use it in my shower, Daisy. I use it in my washing machine. You know how washing machines can smell moldy sometimes? I'll spray it in there, and it works great. So keep using that. And in the meantime, what I did is I'm tunneling through your sinuses. I'm roto-rootering your sinuses to clear them up a little bit and flush them out. Are you using a sinus rinse by any chance?
The thing is, I did. I started using the neti pod, and then I used fluticasone spray, and I've been using Vicks and Vicks inhaler. I use the Vicks inside and out, and nothing works. Nothing is helping. You did a roto-rooter last time, and it felt like it was going to improve, but nothing.
Yeah.
Nothing.
I think it's because you're living. I believe it's because you're living in a moldy environment. And so that's what's going on. So see what you can do to take care of the mold. Do a test to see what the mold level is in your home and go from there. And I would try this.
The anti-inflammatory energy then?
Yes, I did that as well. And I would try the sinus rinses too, with just the saline water, and see if that helps with the neti pot.
It's just that I've been using them, and it got worse. Everything that I do, it gets so much worse, and now I'm afraid of everything. I don't want to try anything anymore.
But you got to get that snot out of there, girl. So that's the best way to do it is with the sinus rinse, because when you leave it all in your sinuses, it just gets infected. So that's what I'm getting. Okay. I hope you feel better. Thanks for calling. Bye-bye. Okay, let's go to Meryl. Hi, Meryl.
Hi. Good to talk to you, Julie.
Good to talk to you, too. How are you?
I'm in Tucson, Arizona.
Well, how are things in Tucson?
Well, today was really windy, but we didn't have the snow that my brother and sister had in Cleveland, 18 inches. Yesterday.
Goodness.
So I'm really grateful I don't live there anymore.
Is that how much they got? Holy Mother. Well, I was telling you earlier, my brother got 5 or 6 inches, but obviously it's steered north of Columbus.
That's nothing. Yeah.
My gosh, that's a lot. Well, they get that lake effect, living on Lake Erie too.
Right.
So the weather gets more intense up there. Well, you got a question for me?
I do. So I was diagnosed with cancer, endometrial cancer 2 years ago, had surgery, did all this alternative stuff. Finally, September of 2020, I did radiation. And since then, I've had so much pain, pelvic pain. It starts lower abdomen, like where the C-section and the scar is. And then it moves into my hips and moves into my back. And I was using Advil that helped for a while, and that's not helping anymore. I tried Gas-X. I tried homeopathic something. Anyway, I haven't found anything that's going to work. The MRI shows edema. One of my healers said that she thought it was that the scar tissue was impinging on a nerve. So, and it could also be gas. So it could be a combination of those things. whatever it is, I want to get some relief. And if you have any suggestions, I'd appreciate it.
Okay.
It doesn't happen all the time. Like right now, I'm fine. But all afternoon, I was on the heating pad.
Uh-huh. All right. So I agree. I think it's probably gas from what I'm seeing. I'm seeing yeast. You know, when you have any kind of surgery, they give you antibiotics in the IV and a lot of times afterwards, just as a prophylactic thing to try and head off infections at the pass. And it just whacks our gut biome, Meryl. So if you email me, Julie at AskJulieRyan.com, I'll send you a link to a gut biome test that, and anybody listening, email me, Julie at AskJulieRyan.com, and I'll send it to you too. It's a little bit of a discount, and it's going to tell you what the critters are in your ecosystem in your gut, which is where our immune system is based. But more importantly, based on the results of the test, it's going to say, here are the best foods for you to eat. Here are the ones for you to avoid. Here's everything else. Eat this a lot. Eat this a little. And food is really the best medicine. So that's what I'm getting. I'm looking at your back. I just did a chiropractic adjustment on you, Meryl. So hopefully that will help too. I'm not seeing anything that looks suspicious at all in your back. I'm just, go find a chiropractor and let them do an adjustment on you. I mean, they work wonders, these chiropractors.
I was there yesterday. I did see my chiropractor yesterday.
Yeah. So
and today I had a massage and felt much better after.
Perfect. I watched you get adjusted again, so it may take more than one session. I think it's good to go like every other month or something just to keep everything lined up.
I go to Network Chiropractor. I go every week.
Perfect. That's good. Yeah, I think this is GI related with you.
Okay.
Give that a whirl. Okay. Well, thanks for calling. I hope you feel better.
Thank you so much.
Take care. Bye-bye. All right. Let's go to Agata next. Hi, Agata.
Hi, Julie. How are you?
Thank
you so much for taking my call.
You're welcome.
Thank
Please tell everybody where you're calling from.
I'm calling from New York.
All right. New York City.
Yes.
Yeah.
Cold New York City.
Well, it is December. You know, it's kind of like to give you the ambiance with the Rockefeller Center decorations and stuff. I saw the tree arrive. Do they have the angels and stuff up yet?
Well, we all have something like 5 minutes. They're giving us like we have to wait in line, but I'm going to see it.
Yeah.
I didn't see it yet.
Good.
Yeah.
Good. Well, you got a question for me?
Yes, my dear. So it happens on and off sometimes in this time of my life. I don't know, but I have this tenderness in the right breast. And it just feels like, it's just strange. Like the right one feels so different. It's like a little lumpy, little tender. I wonder if you see anything. I just want to, confirm that it's nothing terrible.
All right, right breast. So here comes my laser beam from Alabama heading up to you in New York. All right, got you. It looks inflamed to me a little bit is on the right side of your right breast, Agata. Is that where it's tender?
Yeah, it's like a little tenderness.
Yeah. Do you wear an underwire bra?
The thing is, I don't.
You don't?
I don't.
All right, because that usually can cause tenderness. If it's that the bra doesn't fit right and it causes pressure. I see so many cysts on women that wear underwire bras, and it's like under the arm where the wire comes up on the side. So
totally, I know, I heard about it, but it's more like, I've had it before where you told me like I had a little cyst and you helped me to like dissolve it. It's just a little stiff.
Yeah,
it's
a bigger area that looks inflamed. So I'm applying anti-inflammatory energy on it now. And there's like a little kernel of something in there. Looks like a little piece of popcorn. It's not malignant. It's benign. Okay, I'm getting it out. Okay, I've encapsulated it and gotten it out. All right. And then I'm putting just a little dollop of stem cell energy in there just to regenerate where we took it out. So that'll go back. So hopefully that will help.
You're an angel. Angel of stem cells.
I know, stem cell. I love stem cell energy. It's just so fabulous. It's amazing.
But I'm so happy that it's not malignant, because I'm sure it will go away thanks to you.
I think it will. Yes. But if it persists, go get it checked out. I mean, that's not going to hurt anything. Go get it checked out.
Yeah.
Yeah.
Totally.
So,
Okay. Thank you so much.
You bet. Thanks for calling. Take care.
Thank
Bye-bye.
you. Bye.
Bye. All right. Let's go to Barbara next. Hi, Barbara. Hi, Barbara.
Hi, Julie. How are you?
I'm well. How are you?
Can you hear me? I'm great. Thank you. Thank you for taking my call. I'm calling from North Carolina.
Yes. Well, what's happening there? Everything good?
Everything's great. Yeah. Wonderful. We had snow a couple days ago, but now it's gone. But I think we're supposed to get snow tomorrow again.
Uh-oh. Well, hopefully it won't last long, but it'll just be pretty while it's on the ground.
Indeed.
Yeah. Barbara, stay with me. I'm going to hold you over the break, and then we'll pick you up on the other side. Everybody, we'll be right back, and we'll see what Barbara's question is. Stay with us, everybody. Welcome back, everybody. Before the break, we were talking with Barbara from North Carolina. Barbara, we are ready for your question. I'm eager to hear what it is.
Okay. 10 years ago, I was diagnosed with an overactive thyroid. So the doctor recommended that I have radioactive iodine ablation, which I did. So I'm wondering how my thyroid is doing now. I am on supplemental thyroxine. So I'm just wondering, how is my thyroid functioning now?
Are they showing any function at all in your tests, in your blood tests?
Yes.
Okay. All right. You want me to see if we can regenerate it energetically?
Please. Thank you.
Okay. Yeah. All right. Here comes my laser beam from Birmingham, Alabama to North Carolina. All right. Here we go. Heading northeast from me. All right. Got you. Shooting energy from your feet up to the top of your head in your thyroid. Okay. We're cranking it up. And then we're going to see what we need to do to regenerate it. So it doesn't look like your whole thyroid was blasted. It looks like just parts of it are not operational. Is that true? Did they just blast one side of it?
Exactly, yeah.
Yeah, that's what it looks like. Okay. So what I'm doing is I'm removing the side that was targeted. Let's use that word. And then here comes a dollop of stem cell energy, my trusty stem cell energy, light amber colored gel with sparkles in it. You know, you got to have sparkles when you're doing woo-woo. It's just the law. And then it's got a watery consistency to it. There's a vortex spinning above it that is going to transform it into new thyroid tissue. Okay, so it's starting to come online. And when I see a thyroid that's healing, it looks to me like pink tissue moving across the screen, like from left to right. Have you ever seen a cartoon, perhaps, that was in black and white, or a movie, and then in the middle of the movie, they colorize it? Like The Wizard of Oz is a great example. You know how it's black and white till she gets to Munchkin Land, and then it turns colored. It turns into a colored film. That's what it looks like to me. So hopefully that will help. Pay attention to how you're feeling, Barbara, because I've watched this healing with a lot of clients, and I say, if you start feeling jittery or you start feeling weird, call your doctor and get tested, because sometimes it can affect, what your medicine is. They may need to lower your dose. So pay attention to how you're feeling with that. You're welcome. Thanks for calling.
Thank you so much.
You bet. Take care. Bye-bye.
You too. Bye-bye.
Okay, we've got somebody from Glenview, Illinois. I don't know your name. Hi, what's your name?
Glenview.
Hello?
Hi.
Hello? Hi.
Hi.
What's your name?
I'm Bonnie from Skokie, Illinois. Skokie.
Hi, Bonnie. How are you?
Hi. I can't believe it. I finally got on. Oh my God. I've been waiting all evening and other weeks too. Oh my goodness.
Oh, wonderful. I do my best to get as many on as I can, and we always have a lot of callers. So you got a question for me?
Yes, I do. Today I wanted to ask about my cat. A cat, Alex, my talking cat. And I'm a first-time caller also, I wanted you to know. So I'm a little nervous. My cat likes to wake me up at night, the wee hours, so I don't get a lot of straight sleep. You know, my sleep is broken up most of the time, and so I wanted to ask. Well, he does have a condition. The cat has feline lower urinary tract disease, they call it. Okay. But he's doing better, I think, with that. That's not why he wakes me up. Well, sort of. He wants to let me know he's going to the bathroom. And sometimes we meet in there and we both are, you know, at the same time. That's fine. But I want to get back to sleep right away, and he doesn't always want to do that. He doesn't like to be alone for too long. So he and I are I can't think of the word. My notebook isn't in front of me.
Incompatible.
We're in quarantine. We're in quarantine together. We're in quarantine because I live alone. Well, I've had him for a couple of years, 2.5 years now. So thank God he's been my companion and my.
So
my
Bonnie,
everything.
I've only got a couple minutes left. So did you have a question for me?
Behavior. Well, I want to know if because he came into my life in a very unusual way. I wasn't looking for a pet. And I'm wondering if he is an angel. I call him an angel sometimes. So I wonder if he is like an angel for me, because I don't know what I'd do without him during this pandemic.
I'm not getting he's an angel, but he's, you know how in really every indigenous culture they have animals that are more like spirit guides, and they're there to help us and be companions and all that. That's what I'm getting, is he's more of a companion to you. And
okay. So,
and it's more like a spirit guide, kind of a situation.
Yeah. Well, that's what I kind of feel, you know, I have felt that, you know, with him.
Well, terrific.
So,
well, as far as him waking you up at night, can you keep him out of your bedroom?
No, he'd be scratching on the door. I can't, no. No, actually, I like him with me, to be honest.
Okay.
So,
but not that he's waking you up all the time.
Yeah.
So let's ask him real fast. Alex, what's up with you waking up Bonnie all the time during the night? He's saying he gets hot. Is he under the blankets with you?
No. All
right. He's saying he gets hot. Do you keep your home hot at night?
No.
Yeah.
Well,
give that some thought. So we are out of time, Miss Bonnie. So thank you for calling in. I hope that helps with Alex the cat. Everybody, thanks for joining us this week. Give us a call next week. AskJulieRyan.com. You can find everything you want. Have a terrific week, everybody. See you next Thursday. Bye now.
Be sure to follow Julie on Instagram and YouTube at Ask Julie Ryan, and like her on Facebook at Ask Julie Ryan. To schedule an appointment or submit a question, please visit AskJulieRyan.com.
This show is for informational purposes only. It is not intended to be medical, psychological, financial, or legal advice. Please contact a licensed professional. The Ask Julie Ryan Show, Julie Ryan and all parties involved in producing, recording, and distributing it assume no responsibility for listeners' actions based on any information heard on this or any Ask Julie Ryan shows or podcasts.